Okay, well, thank you. Good morning or good afternoon, everybody.
Good morning.
I think we'll get, to respect everybody's time, we'll get right to it and get right to Commissioner Harris for her update from the health perspective.
Thank you. Hello, counselors. How are you this, is it afternoon or morning? It's still morning a little bit. Hope everyone is safe and well. Currently in the city of Springfield, we have 342 positive cases. We got 57 new ones yesterday, and that brings us to the 342. That map has been put up. Those numbers are on the city's website. We have 6 public school nurses who are helping us to do contact tracing. As you know, the positives come in through our software, our Maven portal. We take those positives off of the portal. We then have to call each one of those individuals who are positive, and we also have to trace their contacts as well. Right now, we are at well over 500 contacts, so that's 842 individuals or more that we need to follow up with. As you might imagine, it is an overwhelming task, but everybody's doing a great job of doing the work. We will be establishing a hotline for COVID-19 only. That'll go live hopefully by Monday. I'm trying to put the staff in place. It'll be staffed on the weekends as well, and so I want to make sure that we have everyone in place. The field hospital for homeless is projected to open either Friday or Saturday. We are still working to try to make sure our overnight staff is in place. We're working with AMR for that portion. So that's a broad brush of where we are right now. I'm happy to answer any questions.
Tom, are there any other updates before we turn it over to questions from anyone else in the room?
I think we can cover our updates, Council President, by way of the questions.
Okay, so what we're gonna do, counselors, is I'm a little different than our city council meetings. I'm gonna go in order, and so that everybody has a fair opportunity to ask the questions that they wanna ask. The other thing I wanna caution counselors is that we are going to have a meeting with our public safety department heads on Monday at 11:15. So again, if you want to ask detailed questions with respect to public safety, we are going to have that meeting on Monday at 11:15. And in addition, we are also going to have Tim Sheehan there, who is going to speak to from an economic development standpoint. So if you have questions that are directly related to Commissioner Clapprood or Commissioner Calvi, then please reserve those for Monday. Otherwise, we'll have to defer to Tom to answer those questions. And I normally don't do this, but I'm going to start off this particular meeting because I am the president and I'm running it with a question. So I apologize to my colleagues. Normally, I wouldn't ask a question. I received a call earlier today, Commissioner, from an individual who was literally crying on the conversation, and she was crying because she has her brother at Wingate nursing home, and what she felt was that she had no one to turn to address the issues that are going on at that nursing home. And I know that this particular problem is not solely related to this nursing home. In fact, it's probably happening throughout the entire city. So what I would like to know is, at what point in time can the health department or the city of Springfield step in and say, listen, enough is enough. What is happening at this particular nursing home and other nursing homes needs to be addressed, and this is how we're going to handle it. Have we had any sort of discussions around what it is we're going to do and whether we have the authority to do something. She said that she heard that there were about 40% of folks who had tested positive over there. I don't know whether that's true or not, but I do know we had an issue, I believe, at Kendall Commons as well. And this is probably something that is going to be an issue throughout the city at a variety of different nursing homes. So how can I appease this particular constituent who called me? Is there anything that we can do or we're planning on doing? Thank you.
Thank you for the question. And as you know, we are very concerned about nursing homes across the nation, but certainly Chapin has emerged as one that we're watching very closely. We are also watching Wingate on Bicentennial Highway. I do not have 40 positives there at this point. The positives at Wingate at this point are, I believe it was 7 or 8. So it did not appear to be 40. So what happens when we get a nursing home cluster is that I work very closely with the epidemiologists at the state level, as well as state DPH to monitor that nursing home. Currently, we are watching every nursing home in the Commonwealth. And so if you want to give that individual my direct line, I'm happy to follow up to try to figure out if their relative is not being treated appropriately, or if there's something that we can do from a Board of Health to be more on target as far as assisting the individual. Happy to do that, but you're absolutely correct. We are watching Wingate on Bicentennial Highway with the State Department of Public Health, and so far there are 7 positives there.
Thank you, Commissioner. Next, so the first up I have Councilor Letterman. If you have a question, you can ask it at this time.
Thanks, Mr. Chairman. Commissioner, of the 342 positive cases, is that 342 total since the beginning of the outbreak, or is that 342 active?
That is 342 positive since the beginning of the outbreak for us. That is March the 6th is when I reported 0, and it has been going up since then. So yes, it's from the beginning.
Do we have a recovered number?
I do not have a number that have been recovered. I think the hospital can give you a number, or you're probably reading the hospitalization number, the number of individuals that have been hospitalized. And they are also reporting their discharge numbers. So I do not have a recovery number. I can only depend on the State Department, on the hospitals to give us their data.
Okay, thank you.
Thank you. Next, we have Councilor Fitton, followed by Councilor Gomez.
Thank you, Mr. President. I have 2 questions, but I hope they're really quick. So the first is yard waste pickup continuing as scheduled as of today?
Yes, as of yesterday.
All right, and then they haven't picked up mine.
They're a little behind. They're a day behind. And I gave Director Signoli a hard time because my leaves are still on the curbs.
Oh, and I got it from my sister too on Winton Street. So, but the second question is regarding schools. A teacher at Central told me yesterday that they received some type of guidance about closure beyond that date that's already been disclosed, May 4th. Is there any update about the public schools and plans for the rest of the year?
Hasn't gone beyond, anybody jump in, hasn't gone beyond that date. We meet and discuss that with the superintendent. Yeah, every morning, and he hasn't discussed it. Discussion this morning was around MCAS and how they're going to handle that, obviously, if at all, but no discussion on closure beyond that May 4th date.
Councilor Fenn, there is conversations happening at the state level, or at the local level rather, the state's punting it, that if districts want to cancel their April vacations and get out a little bit earlier in June, that is a district decision. But that's a conversation that I think the superintendent's going to have with the school committee tonight.
Thank you.
And before we turn it over to Councilor Gomez, just from my colleagues, Tom and myself had a conversation also about getting the Superintendent Warwick to one of these isolated meetings so we can do a deeper dive. What he did want to do, which I thought was reasonable, was have a conversation with the school committee first. And so as not to get in trouble with my wife, I thought that made sense. So once he does that, then we'll make sure that we have an isolated conversation with him. Next up is Councilor Gomez, followed by Councilor Davila.
Mr. President, can you go to Councilor Davila first and then me? I just want to pull up my question. I apologize.
Councilor Davila, followed by Councilor Ramos.
Thank you, Mr. President. Glad to see everybody's doing well. Commissioner Halton, I have a quick question, point of clarification. You say you started tracking the cases March 6th or 26th?
6.
March 6th. And we have 342 cases in the city, right?
That's correct.
So kind of make a comment first before I ask my question. I feel that, and thank you to all of you, because I do know that I'm fully aware that all of you are doing your very best to deal with this situation. Excuse me. However, I feel that I don't have any real way that I can measure the progress that we have made so far. You know, I know we have a lot of things going on once. I apologize. And so my question is, can you provide us with a daily update on the positive cases throughout the city? You know, I feel we should be provided that and even made public. You know, you guys can work that out yourself, how you want to do it. But I feel that would give us at least some sort of measurement. Because if I'm not mistaken, we went up like 80 cases from the last time we met, less than a week ago. And so I'm sure that now the real number is much higher than that. So that's my comment on my question, Commissioner. I would really appreciate if we have a daily update, whichever is easier method, so that we can know exactly how many cases we have on a daily basis in the city.
Counselor, I'm unclear about your comment and what is it you would like us to do to help you with your assessment of the work that's being done currently, or what additional information you need? I'm a little confused.
Yeah, I just feel that we can, if I can get into the computer with a few clicks, find out exactly how many cases we have in the state and in the country, I should be able to do the same thing for the city.
You can. If you go to the city's website, the cases, I'm sorry, if you go to the city's website, the cases are updated on a daily basis. So that 342 is up there for you to see. Is there other information I can help with?
No, actually, that's great. I wasn't even aware that was up there, and I've been coming to these meetings daily. Every time we have them. So if it's there, if you say that it's there, that's much easier for me. And as long as I'm reassured that that's a daily number update, I'm okay with it. But I was not aware that was up there.
It's on the home page of the city, so we update that daily. Yes.
Thank you. I'm going to look for it right now. Thank you, Commissioner.
Thank you, Councilor Davila. And I actually have checked on a couple of occasions, and it's been there. So I appreciate it. I appreciate you, Helen Cotton, or Commissioner Harris, for putting it up there. Next in the queue is Councilor Gomez, followed by Councilor Ramos.
Thank you. My question is specific to a letter that I had sent out to my colleagues. It's for more for Chief of Staff's Tommy Ash, and I was approached by a couple of union leaders, and I don't know if the girls had sent out the letter this morning, and I don't know, it was directed to the mayor, the solicitor, and also Helen Colton. And it was more behind the, I know that there was the letter was basically asking the administration to halt non-essential, excuse me, I'm having a tough time, non-essential projects, construction projects. I know that some unions have pulled off their unions off the job. And, you know, I know a couple of my colleagues signed on to this letter. I'm unaware if the administration has received it already, probably this morning. But Tommy, what are the plans of the administration, or if you can answer that, if you haven't received the letter as of yet, specific to these non-essential, like outside of the school, because I know that we talked a little bit about it in our last meeting. Aside from the school, and in the letter, just so I can give it some, it's more, in our opinion, the list of emergency and essential construction would be limited to emergency utility building work, such as gas leaks, water leaks, and sinkholes, new utility connections, mandated building and utility work, work in public health facilities, etc., and work which ensures the reliability of the transportation network, and other work necessary to render occupied residential buildings fully inhabited. So those projects specific to that are like residential projects that are deemed non-essential that need to go on. And what we're asking is like a 3-week halt, not like a halt like that's an extensive halt, because I know that there's been a lot of conversation within the state, but like us and our projects that we're involved in, how do we give a sense of security to those folks, or what's the plan with that?
Sure.
Thank you.
Thank you, Councilor. So I think I know our position is to follow the guidelines that the governor has laid out in terms of construction. And so as an example, I think at Brightwood, the work by and large moves on. I know that there was, through discussions with Councilor Ramos, the carpenters have halted work, but the other unions are still in the job. So to the extent that there's public works going on, which I think only now is Brightwood, then we're following all the guidelines and the mandates that the governor and the state has put in place, including making sure that there's social distancing and all the other preventive measures that can take place. But we're adhering to those guidelines and making certain that those as people are following those. TJ, I don't know if there's.
No, you just summed it up accurately.
I don't know if that answers your question, Councilor Gomez.
No, essentially the other project, I knew that the school project, because we had talked about, and I understood that the school project was ongoing. It was more like Indian motorcycle and projects like that are, not saying that specific, because I know that they have people living in there still. If they were doing some stuff that were essential to that project, if we're in conversation with them and protocols, because the building trades and obviously the painters union and the carpenters union essentially have been very concerned, specific to wanting to make sure that, because at the end of it, that's where there's a lot of going back and forth of people. And obviously with this being they said that the most critical, from what Commissioner Helen Culper said, most critical 3 weeks. I don't know if the administration was looking into, maybe because of this critical time, just suspending some of this work while people should be adhering to the advisory of the governor, and also having to wear masks, and that was kind of a concern.
I think aside from the guidelines that are put in place on an emergency basis, like you mentioned at the motorcycle building or on Girard Avenue, we certainly don't want to put people out on the street that we think we can help get back into their homes, whether it's Girard, which now is fixed and people are moved back in, or the Indian motorcycle building, that we would consider emergency of an emergency basis, and we're addressing those. But anything that's not, Councilor, then we're going to follow those mandates and make sure that we are.
All right. Oh, and just a big thank you that I received a correspondence from David Cotter that building folks are back in there and not out on the street. So I got the correspondence with that, and I appreciate his letter, and I'll just follow up with that with you guys after. Thank you.
We're happy.
Thank you, Mr. President.
Thank you, Councilor Gomez. We have Councilor Ramos, followed by Councilor Whitfield, and then Councilor Allen.
Mr. President, thank you. Good morning, everyone. Thank you, Tommy, for that, for the your input regarding Councilor Gomez's question. I actually have a follow-up question to that. I'm wondering what we're doing in terms of making sure that we're checking on construction sites to make sure that they're following the governor's recommendations. I had a brief conversation with Commissioner Colton Harris yesterday. She had indicated that her department is not doing necessarily inspections or walkthroughs of those construction sites. She asked me to call Commissioner Desilets. I did. He also indicated that his department is not doing any walkthroughs or checking on construction sites, and so it seems that they're operating without any sort of supervision. And so we're saying that we're taking careful, measures at Brightwood, but what about the other construction sites in the city? Who is actually monitoring those?
Peter Garvey's department does that regularly, and I believe they're still doing that. I'll check with him, but he has staff that goes out every day to construction sites to monitor. So I'll double back with Peter Garvey, but to my knowledge that they're still doing that.
Council, you talking about private projects or public projects?
Private projects.
I don't know if we're doing private
Oh,
projects.
probably not private projects.
Okay, so we can talk to the commissioner, police commissioner. We just gotta know if I guess if we know there's a problem, I don't know if we can do every project. If we know that we think there's a problem, and they're not doing the proper social distancing, or they're not doing, what they need to be doing, I guess we can figure out a way to check on it, but because I don't even know how many projects going on in the city that are non-emergency right now.
Yeah, and I don't assume that we need to check on single family home or being built, but some of the bigger projects, private projects, we do need to have someone monitoring those. Councilor Gomez and I were discussing a study that was conducted at the University of Texas, Austin, and Councilor Gomez is going to be passing that around, that it shows that this disease is highly transmitted on construction sites. So it's important to make sure that we're monitoring every construction site in the city.
Okay, thank you.
Thank you, Councilor Ramos. Maybe we can circle back around to that next Thursday in hopes of getting some more information, Councilor Ramos and Councilor Gomez. Next up is Councilor Whitfield, followed by Councilor Allen.
Thank you, Mr. President. Thank you, everybody who's on this video call. My question is to the commissioner. I wanted to know if you had any data on the demographics of the folks that are sick, like as far as race goes, because from what I'm reading, the African-American community and probably the Latino community are being hit the hardest by deaths of this virus. And I just wanted to know if you had that information, because I will be writing a letter to the governor to see if we can get additional funding for those communities.
Thank you for that question. As you know, that's a discussion that's happening across the country. We do have, there is data that I just got actually an email from Carlos Gonzalez, who is also asking for that data at the state level. So the state does have that data by race and ethnicity, but what I can tell you for the city of Springfield is that those areas that are have high density have more cases right now than some of the other neighborhoods in the city. Well, that's we know that people of color, health indices and underlying health conditions, there's much more health disparities in communities of color than there is totally in the population. So that means that the underlying conditions really are a precursor to this really having some catastrophic outcomes for this virus. So that's the first thing. The second thing is high density. When people live close together, then we're going to see that this virus is going to spread quickly amongst neighborhoods and populations. And if I look at the zip codes in the city of Springfield, there is a higher concentration of individuals of color in those zip codes. But this is very early, but I can tell you that we are absolutely following those trends. But I do not have the demographic data broken out in the way you might want it at this point. But we certainly will be going back in to get it. My goal right now is to make sure we're contacting every one of those positives and every one of those contacts. But I think your question is a valid one, and it's one that's being asked not only in the Commonwealth, but across the nation. So thank you. And hopefully we'll have that data soon.
Understood. Thank you very much.
Thank you, Councilor Whitfield. Councilor Allen.
Thanks, Mr. President. One comment and two questions. First, Mike, the grass clippings and stuff got picked up at my house today, and your sister lives on Winton, so they ran a day late, but it's all picked up now, so hers should be picked up. Secondly, I've been kind of following the cases worldwide and countrywide and mass-wide with these numbers every day, and I like the increase by my math worldwide or something yesterday was 3% from yesterday to today, whereas in Massachusetts it was 10%. So Helen, are we on a pace where we're not? And you know, I listen to Cuomo every day, and there's been a little flattening in New York of the last 2 or 3 days. He's on now, so I don't know what he said today, but are we still expecting that our apex or whatever is still ahead of us? I mean, everybody's still expecting that, but New York's starting to see a little flattening. What are your expectations based on the numbers?
So I do anticipate that we are going to see, I don't think we've reached our apex to answer your question. I think our numbers are going to continue to go up. And I think we have to be very vigilant about the protections or the preventions that we put in place. And all of us should be talking to our constituents to stay in the house, social distance, and wash their hands frequently. But I do think that 342 is going to continue to climb. And we won't know if we've reached our apex until we see at least 3 days of flattening. So we want to see 3 days of the numbers staying pretty consistent and then start to go down. Then I can say to you, yes, we are on the downward trajectory. Bay State Medical Center is reporting that their admissions that they're discharging and the individual numbers that they're admitting seem to be going down a little bit. Nobody is relaxing around this yet, but I think over the next 2 to 3 weeks, just as in other places, I tell Councilor Hurst, watch New York, because I think if we look at timelines, we can look at New York and see what that timeline was. They're starting to see some relief now. I think the city of Springfield is behind them, and we're also behind on some levels the eastern part of the state, where you see some of the numbers are higher. The wave is coming this way. That's the way I'm interpreting it based on the numbers I'm seeing in the city of Springfield. And so I think over the next 2 to 3 weeks, hopefully we'll reach our apex and start to see those numbers decrease. But I think Massachusetts, if you look at our deaths, I mean, they're significant. Let me just say that.
For sure. And my final question that goes with that is, in the last few days, I saw that we had ordered 3,000 masks or something, and then Mass Mutual donated some, and then Holyoke Medical Center donated some, etc. Is there a process for this? Like, did the process not work? The 3,000 we ordered, the process not work? Or
Good question, Counselor. I pretty much spent my entire day trying to track down masks to make sure that our front lines get them. And so what happened was we ordered 3,000 from MEMA originally, like a few weeks ago. MEMA did not fulfill that request and directed them to the hospitals. So we did not get the ones we anticipated. We ordered 5,000 from a company that were intercepted by FEMA and put at the national level to be redirected. So now we're in the process of ordering approximately 25,000 with 4 different vendors that should be coming in, hopefully, if they don't get intercepted by the federal government again, it should be coming in 7 to 10 days from now.
Okay, so presumably when that gets filled, would be all right for a while?
Yeah, so if we had 25,000, I've been assured by both commissioners and others that should be sufficient to meet our needs for unless, I guess all bets are off if this is a long term or if we had a resurgence of it in the fall, but we should be in good shape.
So maybe Monday when we have the public safety update, I don't know if you're on that call, but if you could just get that info to someone who is and see if we're still on course to get that stuff.
That's the hope. I mean, we got, the problem that we had is that we got probably 30 vendors calling us due to yesterday's press conference, and about 15 or 20 of them were fraudulent or sketchy or shady. So we had to really make sure we track down good vendors that can actually deliver the supply that they said.
All right, good. Good. Thanks for being on it. That's great. Thanks.
To add to that, I can tell you that since yesterday, the last 24 hours, we've received private donations of about 1,700 N95 masks that we've already distributed to our front line. So that was good.
Great. Great.
Thank you, Councilor Allen. So colleagues, we have roughly 13 minutes, so I'm going to try to shoot back around. I added an additional 5 minutes on Tom, so I hope you don't mind because I think we started a little late. So we'll circle back around. If you don't have a question, then just merely pass. Councilor Letterman.
Thanks, Mr. Chairman. Commissioner, what do we know about the status of testing right now? I know they're setting up a testing center in West Side for first responders and healthcare workers, but where's our medical community on obtaining tests? And related to that, I was speaking with a neighbor of mine who's a doctor who has a small private practice, who was wondering about at what point they may be able to help with testing, and also they are now running low on PPE because of the high demand. Do we know kind of what distribution to medical practices that remain operating at this time are in terms of their access to PPE?
So let me say that there is, in my opinion, and this is my opinion, there is a geographic disparity as far as the allocation of test kits are concerned. We have had a very difficult time I have had a very difficult time getting test kits in the Western region. I'm sure they're at the hospitals, but for example, in Boston, they test 700 homeless individuals, and they found 200 of them were positive. We built a facility with a tent specifically for testing, and I cannot get test kits to go in that tent. And so for me, it's a geographical disparity as far as having access to testing is concerned for the population, I believe, that needs it the most. So I am, I certainly understand the concern, and the only way we're going to be able to know how widespread this virus is in any place is to test and to know where it is so we can begin our prevention and intervention efforts. So it's an excellent question. As far as PPE is concerned, it's my understanding, I'm not sure about private facilities, but it is my understanding that we have sufficient PPE, and I'm talking about now we have N95 masks, we have gowns, and I'm specifically talking about for the tent that we constructed for individuals. Not sure about private doctors.
Who is responsible for getting those tests to us? For example, for the tent that we've built for the homeless population, who's supposed to give them to us that isn't?
I would assume that it is the Executive Office of Health and Human Services through the State Department of Public Health. So I really, that is an assumption on my part because I'm not sure who in fact does the geographical distribution, but I do know there is a gap here. In my opinion, again, there is a gap here because people are constantly asking me, where can I get tested? And I do not have the answer to give to them because I don't know where tests are available for general population that is non-symptomatic or even symptomatic in some cases.
Okay, I'll follow up with you after this. Thank you.
Thank you, Councilor Letterman. Councilor Fenton, did you have an additional question?
I did, but I'm trying to look something up. Can you come back to me?
I can. Councilor Gomez, did you have another question?
Thank you for your consideration. As of right now, I don't have any questions. Just want to tell everybody, keep up the good work. And TJ, I'll be in contact with you.
Thank you.
Thank you, Councilor Davila.
Thank you, Mr. President. My question is for Tommy. I still feel like I need more clarification as to what happened with the N95 mask. As you know, I brought this issue up privately to you, to the commissioner, to the several other people. I Give me that explanation again, please, if you could, because I really don't quite get it.
Okay, so I'll take this one, Counselor. So we ordered from MEMA 3,000 masks 3 weeks or so ago that we thought were en route. The commissioner followed up with MEMA yesterday and was told that they were never coming to us because they were being diverted to the hospitals instead of being diverted to frontline workers that we have. So those 3,000 we thought we were getting did not come in. I ordered another 5,000 from a vendor who was ready to ship them within 7 to 10 days. And I got notification that FEMA, under the presidential directive, intercepted all the orders coming into different states and different localities and redirected those masks to other states and other areas. So we were out of those 5,000 masks. So now we were running low, so the mayor did the press conference yesterday, and yesterday I found 4 vendors that can get us up to 25 to 30,000 masks that we have now since put on order that should be here within 7 to 10 days. The only thing that they caution against is if FEMA and the federal government comes in and confiscates the masks again and the PPE that we've ordered through the president's direction, that's the only thing that we're waiting on now. So we've done our piece. We've got them in the system. BJ Calvi and his team has done the requisitions, the purchase orders. So we're confident. The good news is that since all the donations that Tom spoke about, we have time. So we're no longer in an emergency situation. We have time to let this all unfold.
Okay, just to finish that off, how much time do you think we have?
I mean, what would you say?
Summer. We have a couple of weeks.
A couple of weeks anyway now.
All right, thank you, gentlemen.
We're joined by solicitor if anyone has any questions for him.
Councilor Fenton, did I freeze?
Yeah, thank you, Mr. President. I don't have any questions at this time.
Okay. Councilor Whitfield, did you have an additional question?
I do for Tom or solicitor, since he's there now. I had gotten a call from a constituent that rents, and she was being forced to allow, from her owner, to allow solar panel folks in her house. And she was scared because her children are there. She's been doing everything she's supposed to do, social distancing, quarantine, everything. And now her landlord is threatening to evict her, which I don't think can happen, but also is trying to force the solar folks into her apartment. So I don't know if there's anything that can be done to assist folks in that situation. I agree with Councilor Gomez and Councilor Ramos that non-essential construction should be on hold for a while, but I know that we're following the state mandate or the state laws, but this is ridiculous. Like she's putting her family at risk based on what her owner thinks should be done.
Counselor Ed Bakula, I think you should ask her to call the clerk's office over at Housing Court,
Okay.
and she should seek a restraining order against her landlord through the clerk's office specific to that situation. I will text you the number so you can give it to her.
Thank you very much. I appreciate that.
Thank you, Councilor Whitfield. So we only have 2 councilors who haven't asked a second question. So if you could just, if the administration could just indulge us while those 2 councilors ask their questions, if they have it. We have Councilor Ramos, followed by Councilor Allen, and then we will conclude our meeting.
I did ask a question already, Mr. President.
Oh, you did? Okay. Councilor Allen, sorry. You asked a second question?
Yeah, thank you. Just one question. I've been watching the Cuomo news conferences every day, and he gives the state information for New York, obviously, et cetera. Is there a similar thing, maybe not publicized to the public, but does Baker do that kind of thing that we participate in or we contribute to that?
We watch it. Today he's on at 1 o'clock with his update.
Is it a daily thing or a couple times a week? Or?
Daily update.
Different times, but
Different
every
times,
day.
but every day he updates us.
Okay.
Updates the public, sorry.
It's on his website, Counselor Allen, if you check that in the morning.
Okay, great. Thank you.
And it's streamed live through WWLP if you wanted to watch it.
Okay, excellent. Thanks.
Okay, so thank you, counselors. Just a couple housekeeping notes. Again, we're going to have a meeting with public safety officials as well as Tim Sheehan from Economic Development on Monday at 11:15. I will send out a reminder as well as the Zoom link from Focus Springfield. Hopefully, counselors can be in attendance. Finally, just in order to make that run smoothly, what I'd like to ask is if counselors have questions that they're thinking of now that these individuals could speak to in advance before we ask them questions or follow-up questions, then if you could email those to me before the meeting, preferably by Sunday, then I can compile those questions and get those to the respective department heads so they can speak to those issues at the outset, and then you can ask follow-up questions so that our conversations can be much more meaningful. So again, thank you, Tom, Commissioner, Solicitor, TJ, you guys are doing a wonderful job. And if there's any way in which we can assist any further, let us know.
Counselor Hurst, would you give my number to the woman you said who called you crying? I'd be happy to talk to her. And thank you.
I would greatly appreciate it. Thank you, Commissioner.
Thank you all for all of your help. You guys are a fantastic resource to us.
Thank you very much. Thanks, guys. Great job.
Thank you. See you Monday.